My name's David Green. I work in San Antonio, Texas. Well, my main mentor was Bob Carroll, who had the first 12-month hand fellowship in the United States. And many of my best friends in hand surgery are guys that served the same year of purgatory, just in different years. A couple of the people that I really I looked up to and got advice from over the years were Jim Dobbins at the Mayo Clinic and Dan Reardon in New Orleans. Dan was just, both of them were walking encyclopedias and both really nice people who wanted to share their information. One day I called Dr. Reardon to ask him a specific question about a specific congenital hand problem. And he proceeded to just step by step lead me through the whole operation. And later, one of his partners said, "He's never done that for us," but he did it for me. It was nice. Funny you should ask that. I actually have a list of problems that my generation didn't solve, and we've left it for the next generation. Number one on that list is scapholunate dissociation. I've done probably 18 different operations for that, or I did. I can show you good and bad results of both. So when you have 18 different operations, that means we haven't found the answer. The next one is the PIP arthritis, because I've put in about 4 or 5 different implants in the PIP joint, and most of them are now no longer on the market even. And number 3 is the late DRUJ problems, the instability and incongruity of the DRUJ. That's an unsolved problem. Those are the top 3 on my list of unsolved problems. If I can speak a little more broadly, I think the future of medicine in general is that in a decade or maybe more decades, all doctors will be employed by either a hospital or an insurance company. We have a small group in San Antonio, the Hand Center of San Antonio, which is 5 practicing hand surgeons, independent, and I'm not sure that business model is viable for the future. I think eventually most of us are all going to get absorbed. More and more of my colleagues are working now for hospitals or for insurance companies. So I think that's the future of medicine. I have a very firm opinion that every generation should be better than the one before it, because every generation starts at a higher level. I tell my fellows, if they're not better than I am in a couple of years, I didn't do my job right. And my younger partners are doing stuff like nerve transfers and things that my generation never even dreamed possible. So I think that the ultimate in surgery, of all branches of surgery, is if the immunologist will ever figure out the rejection problem and have medicines that aren't poisons that will preserve and solve the immunological problem, that will totally revolutionize surgery, because will no longer do reconstruction. You just go down and get some parts from the cadaver lab and put them on. Work hard, do your job, and treat people well.